same kind of notions of past and present can be understood in different domains. So in 1822, this is the first operating room out of London, which is a museum today. Very crude. We have made significant progress, quantum leaps in how surgeries are done, but you can see there's a lot of room for improvement. And so what does the operating room of the future look like? We want to show that to you and take you on a journey. To help do that, I, as an engineer, will transform into a doctor. Let's say a famous pediatric neurosurgeon, Sam Brown. So just give us a few minutes to...
It's crispy.
Thank you. So we can switch to the... So what you're going to view is, if you can turn on the lights, please. What you're going to view is, with the help of a very innovative company, Proprio, we are setting up this demonstration. So the operating room is remote in Seattle. It could very well be in Honolulu or anywhere else in the world. And since I'm an expert in surgery, I am going to beam into the operating room through VR. And we'll interact and see if we can do a procedure remotely using a headset. And just imagine it's connected through 5G. Thank you, and this is my sidekick, Nissim.
Hello.
So in front of me is the operating table. And you can see there's a spinal cord in the operating room. And can we get some zoom, please?
Yes. Zoom 2.
Okay, start.
And I have Jim in the operating room with Dr. Evie, Powell, and Dr. David. And I'm going to interact with them. And my task is, and let's see if I'm able to do that, is to place a screw on what I'm seeing in front of me, which is the spinal cord. And this is a very common surgery that takes place in the US, millions of them because of back problems and whatnot. And so the invasive fusion surgery is critical for millions of Americans and patients worldwide. And so you can see I'm interacting with a person in the operating room, Jim, Evie, or David. And then I'm going to place a screwdriver onto the bone, and then they will take over from there. So can I grab the screw?
Yes.
So I'm placing the screwdriver.
Tell me when you're ready.
Yeah. Can I take it off?
Second.
So now what you're seeing is the overlay of the CD data. And this is critical to understand because we are trying to, or Proprio is trying to, eliminate the radiation in the operating room. You might not know that the cancer rates for doctors are much higher than the normal population. And so if you can eliminate radiation in the operating room, significant advances can be made. So I'm taking the screwdriver, placing it back, and then I want to see if I have done it right. So I'm going to zoom in and look under the surface. And normally, the doctor has to look at this CD data on a screen while they are trying to drill. And so there are a lot of errors that can take place, which cost millions of, not to mention a lot of problems for the patients. And so with the help of visualization, you can eliminate a lot of those errors. And what happens is you have to be extremely precise with your placement, because if you get it wrong, you might puncture the aorta or the nerves or damage the spinal cord. And so now Jim is looking at the screw where I placed it and is going to perform the procedure.
Yes, thanks for helping me walk through that one.
You want me to place another screw, Jim?
Yeah, that was a successful one.
Okay.
Let's go for the next.
Okay. So maybe we can try another one.
Tell me when you're ready.
Yeah.
Okay.
Perfect. I'm seeing great alignment from my side.
Great.
Can I get a little bit of zoom, please, Evie? That's a clean screw.
Wonderful.
And alignment looks great. All right. Thank you.
All right. Great. Thank you. So that, ladies and gentlemen, is the world's first demonstration of remote VR surgery.